Salmonellosis is a bacteria belonging to the family Salmonella. A person or an animal can become contaminated with this bacteria. A person can become infected with this bacteria by direct contact with an animal that is a carrier, drinking untreated water, eating contaminated meat that is undercooked, eating raw eggs, or raw vegetables. The digestive tract is actually a very hospitable environment for this bacteria to thrive in. The treatment for this infection will look different depending on how severe the infection is and if it has reached the blood or if it has just stayed local in the digestive tract. Salmonellosis is a gram-negative bacteria, which means it only has a thin layer of peptidoglycan rather than gram-positive bacteria that have a very thick layer of peptidoglycan. Salmonellosis is a rod-shaped bacteria. It is also a facilitative anaerobe. This means that Salmonellosis can survive in the presence or the absence of oxygen, which makes the digestive tract the perfect home. Salmonellosis uses flagella to get around, which is great for liquid as it would be in the digestive tract. There are over 2,500 subgroups of Salmonella, including typhimurium and paratyphi, which cause typhoid fever.
Salmonella can only produce symptoms in a susceptible host if it is present in a large inoculum. After ingestion, the bacteria must overcome stomach acidity and compete with the normal gut flora. If the conditions are right, the bacteria utilize their pili to attach to the cells in the small intestinal lumen. Specifically, Salmonella adhere to the specialized epithelial cells of the Peyer's patches known as microphode cells, or M cells, and the bacteria causes these cells to proliferate. The receptor-mediated endocytosis, the bacteria are internalized and transported within phagosomes to the submucosal layer where they are released. Macrophages are unable to eradicate the bacteria because of their ability to hinder phagosome-lysosome fusion, and the bacteria reside in a specialized niche termed the Salmonella-containing vacuole. At the end of the incubation period, the dead Salmonella bacteria release endotoxins that stimulate a localized immune response. Pro-inflammatory cytokines are expelled and neutrophils arrive at the site of infection. This influx of neutrophils is related to the necrosis of the topmost mucosa in the terminal ileum and colon. Due to the inflammation of the intestinal lining, Salmonella provokes a substantial efflux of electrolytes and water into the intestinal lumen, causing secretory diarrhea and abdominal cramping. Researchers have investigated the pathogenicity islands of Salmonella, known as SPIs, and they have discovered that the bacteria's virulence factors are intricate and encoded on both the organism's chromosome and its large plasmids. Part of the SPI exploits type 3 secretion systems, which are capable of injecting bacterial proteins directly into the host cell cytoplasm. These virulence characteristics are responsible for the ability of the bacteria to invade and persist in epithelial cells and macrophages. Host factors that increase susceptibility to salmonellosis include low stomach acidity, corticosteroid use, diabetes, malignancy, and sickle cell anemia.
Salmonellosis can spread through either food or animals. It can be found in food, vegetables or meat, as well as eggs. Pet rodents can be carriers, hedgehogs or guinea pigs. Children under 5 should not have these pets. Child care centers should not have them according to the CDC. Always wash your hands after handling pet or any kind of pet care, including habitat. Turtles and amphibians are carriers of Salmonella. Children under 5 should not have turtles or amphibians as pets. Children put small turtles in their mouths. They also put their hands in their mouths. Pregnant women, the immunocompromised, elderly, and young children are more susceptible to Salmonella. The best way to prevent the spread of Manella is to always wash your hands after handling food or animals. Wash Countertops, bare surfaces, and even carpets, bacteria can survive for an extended amount of time without proper sanitization. A person can be infected with salmonella through several different ways. One way is by eating food that has been contaminated and is undercooked, by the slaughtering of animals and not washing hands or clothing properly after this is done. Crops that have been fertilized with manure of infected livestock will have salmonella in it. It can also be transported through shellfish and oysters, mussels, and clams.
Under normal, healthy conditions, the body's immune system will fight off the infection in usually somewhere between 4 to 7 days. The diarrhea and vomiting experienced from the infection causes an individual to lose an excessive amount of bodily fluids, and in order to replenish the body's fluid and electrolyte balance and prevent dehydration, one should take in plenty of liquids. However, in the case that oral rehydration proves insufficient and the patient becomes dehydrated, they will need to be admitted to the hospital where they will be put on IV fluids to prevent any further complications from dehydration. In most cases, this is as far as treatment is necessary. However, in the case where the body's immune system is too weak to fight off the bacterial infection, such as immunocompromised patients or elderly populations, they would be put on antibiotics to kill the bacteria. Fluoroquinolones are a class of antibiotics commonly used to treat Salmonella. However, healthcare providers are cautious when prescribing them to children. The two most common antibiotics prescribed for the treatment of Salmonella are azithromycin and ceftriaxone. Specifically, azithromycin has been proven to be effective at treating typhoidal strands of Salmonella. If the infection got so severe that it became life-threatening, chloramphenicol is the drug of choice and can be given IV for a quicker response.
Salmonellosis usually has a greater social impact on developing nations where sanitization and clean water are not well established. In the U.S., the southern and Midwest states are more likely to get salmonella due to contact with farm animals and poor economical status. Educating people on how salmonella can be spread and proper knowledge on hand washing could drastically cut down the spread of this disease and its negative effects on society.